But today's topic is relevant to everyone who is enrolled into a health plan. And this presentation is the first of a 4-part series of Lunch and Learns designed to help people better understand their health plan documents. So let's get started. So after a person enrolls into a health plan, they begin receiving written information from the carrier being the insurance company or an organization that is administering those benefits. These written materials are intended to inform us of how the health plan works and tell us which benefits have been used. But the number of documents that arrive can seem excessive or even duplicative. And people start to think that it's unimportant information. Plus, health plan letters can be very long or difficult to understand. And for these reasons, they sometimes get ignored. Ignoring plan documents can cause problems. OHA is in the business of health insurance advocacy. So we really understand how important these documents are. So because they can be hard to read and hard to understand, as advocates, we're dedicated to help people understand their plan documents. That way, when problems arise or when surprises happen, those issues can be addressed within the time frames allowed by the plan rules. So that's when people call us for advice and help. I am one of three clinical case managers. And Denise, who you met, she's facilitating today. She is our health program associate. Together, we work alongside of attorneys, paralegals, and consumer information representatives to serve the people who call us for help. And it is the opinion of everyone that works at OHA that all written materials from our health plan is important and it might need to be retained. The slide is now showing you several examples of written materials, and these are all important plan documents. Now, 2 of them are highlighted. That's the explanation of benefits statement and the non-coverage decisions or denial letters. These 2 documents are so important and commonly seen that these 2 are specifically part of our health plan document series. They are parts 3 and parts 4. And you can find these presentations on YouTube, and they are from July of 2022 and August of 2022. Today, we're actually repeating the first presentation, and we're talking about the most important document of them all, and that is the benefits book. Your health plan's benefits book is a technical document, and they can be known by a wide variety of technical names. There really is not time today to go into the reasons for the technical names, but just know that if you do not know the official title of your benefits book, you are not wrong just to refer to it as your benefits book. Okay, it is more important, let me take this off, it's making a noise. It's more important to have a copy of your benefits book than to know its official title. And whether you realize it or not, you have been given a copy of this important book. So here's some examples of the different types of official titles of benefit books. All right. And at the very bottom, one is highlighted. I've highlighted the SPD, all right? And I'll come back to that in a moment. But first, I just want to share a little bit more about OHA and the way we help people. Because whenever someone calls me for help, and they've described the insurance issue, and I'm getting a sense of what might be going on, the very first question I ask is, do you have a copy of your benefits book? Because no matter what the situation, and nearly 100% of the time, in order for us to help you, we need to look up your benefits and we will need to read your plan to understand the plan rules. The benefits book is vital. Okay, so now going back to the list. The reason I've highlighted the summary plan description, or SPD, is because the SPD phrase is frequently used generically, even interchangeably with the other titles. Technically, it's wrong to do that because they are different, but it still happens all the time. So because that happens, SPD, I just want to offer a word of caution about similarly named documents before we continue. More often than not, when I ask an individual to try to get a copy of their benefits book to review, the person comes back with a document that's actually called a summary of benefits or a summary of benefits and coverage, which is not the SPD, it's an SBC. So you can hear the confusion. Let's take a look at the SBC. The summary of benefits and coverage looks like this. All right, yours might not be colorful, but it is going to be information formatted into a chart. SBCs are very useful documents, but it's not a benefits book. These tend to be just a few pages long, maybe a half a dozen, and they are really designed to help a person have a quick reference about the structure of a health plan. Structure meaning the copay amounts and the percentage of coinsurance. So these are helpful tools so people can compare different plans when they're selecting a plan. Now, a similar name to an SPD is also the schedule of benefits, and they look like this. They are also charts of information. All right, they're just meant to be quick and easy references about the way a health plan is designed. So these are not benefit books, and that's my point. One surefire way to know if the document you're looking at is not your benefits book is shown here in the red circles. If your document is referring you to another document, it's not your benefits book. For example, here it says, see the policy or refer to the plan document. They're referring you to your benefits book. So other than knowing the official title of your benefits book, you might be asking, how will you really know if you have the right document? And here's a good suggestion. Benefit books are very large. They're the largest health plan document. They tend to be hundreds of pages long. Okay, so it is a dense booklet or a literal book. However, your benefits book might be electronic and only available online. Benefit books always have a table of contents, so that's a good cue. Now, the table of contents might vary from plan to plan, but they all will outline what is important to know about your benefits. Table of contents, most importantly, show you where to locate details about how your health plan works. So it will show you things along the lines of what's covered and what's excluded. For example, it'll tell you rules such as pre-authorization requirements or rules about using out-of-network providers. It definitely tells and gives directions. For example, directions on how to submit an insurance claim or how to submit a complaint or an appeal. And it should tell you how to ask questions about your benefits. The benefits book also gives you legal notices and much, much more. So regardless of whether your benefits book is a hard copy booklet or an electronic version, begin to think of it as a user manual. User manuals need to be read. All right, so I'm just going to show you this slide because they're the cover pages of several of the benefit books that are seen around Connecticut. So it doesn't matter whether you're enrolled in a commercial health plan or a public health plan, you will have a benefits book. So if you no longer have your original, you probably are wondering, where do I find my benefits book? There's only two places to obtain another copy of your benefits book. It will be either from the health plan directly, or it'll be from the employer who's offering the plan. Now, which place to get it actually depends on those technical reasons that I'm skipping over. Therefore, what I suggest is you would contact the health plan in which you're enrolled first and ask them for a copy of your benefits book. You can do that just by calling the member services phone number on the back of the card. If for some reason you would have to get it from the employer, the health plan would inform you of that, okay? So everyone should obtain a copy of their benefits book if they don't already have it. Once you have it, how do you begin to use your user manual? So let's talk about that a bit, using your benefits book. First of all, be sure to note that any phrase that is either in bold text or underlined, that these are key important terms. And it means there's more information to be figured out or learned about those words and phrases. Really think of your user manual as a way to understand three things: the carrier's responsibilities to you, your health plan rules, which you'll need to follow, and lastly, your rights as a member of that health plan. Now, realistically, people are not going to sit down and read their health plans for cover to cover, especially if it's 200 pages long. But that's okay. As long as you have it and you are able to reference it when you need it. However, my advice and my experience tells me that those who do read their entire booklets, they tend to have less problems with their health insurance. If you are reading through your book, you're going to notice things in there that will make you very curious. All right, it'll make you have questions about your benefits. Because too often, the first time that folks read their benefits book is only after something has gone wrong. The first time they call their health plan is because there's a problem. So you can get ahead of the game by getting familiar with your benefits book. All right, things just go smoother when you understand the carrier's responsibilities, your rights, and the rules. Let's see. So if you're looking at your book for the first time, what I suggest you do is First, just read through the table of contents, all right? Maybe even read through the table of contents a couple of times, because that way you become familiar with where to find the information as things come up. But when you're reading through the table of content, be sure to take a minute to identify the section called definitions. Here on the screen are snapshots of 3 different table of contents. And it's just to show you that not all plan documents and table of contents are the same. For example, here, each of these calls the definition section by a different name. One says definitions, the other says defined terms, and another might say glossary. It could be in the front, the middle, the end. There's no consistency. But find the definitions and begin by reading through all of those. Again, that helps you identify where you would go to look for more information. When you're reading through the definitions, take time with it, because you're going to see terms defined that you would expect to see. Something like copay or deductible, or the other example here is a maximum out-of-pocket expense or limit. You would expect to see those. But then you might see unexpected words or words that are very unfamiliar. For example, you might see the word body mass index defined, or custodial care. You might ask, what is experimental or investigational or formulary? What do those mean? Words like those that are unfamiliar to you really should make you curious, all right? Because words that are in the definition section will suggest that it is a key area to understand something about how your health plan works. So I've been doing this kind of work for a long time now, 10 years. And in that time, I've just learned that I never make assumptions about health insurance. But here's my one exception. If there is a word or a phrase defined in your benefits book, it is very reasonable to assume that either a benefit limit, a benefit exclusion, or some type of a plan rule is going to apply. All right, plan rules. I'm staying on definitions here for a minute, all right? Because I want to, they really serve as an example of, this is going to serve as an example of how rules will apply to things that are defined in the definition section, all right? There are 2 words on the screen with definitions, and these are taken right out of a benefit book. The 2 words or phrases really are emergency medical condition is one, and the other is medical necessity, medically necessary, okay? Both of these phrases are very common in the healthcare field and in the insurance industry. But words can have different meanings depending on who is using it, especially in this arena, all right? For example, if you've ever received healthcare services, chances are very good that you and your doctor have decided that something is necessary for you. It could be a medication, a service, a procedure, or a medical supply. In fact, your doctor might even use the exact words, "This is medically necessary." That does not mean your health plan will agree. And it does not mean your health plan is going to cover the cost. And here's why. Because the phrase medical necessity has been defined in your benefit book, it suggests that your health plan will conduct its own review of the situation, and they will use their own internal, even though public, internal definitions, and they'll use your plan rules before they will approve something as medically necessary. Now, the same example is true for the other word, emergency medical condition. All right, it's defined. Again, you, your family, even doctors rendering care might call something an emergency. That doesn't mean that your health plan will agree and cover the cost. So these are examples of how defined terms in your benefit books suggest there could be, and there could be plan rules. So there you go. After you've read your table of contents and you've gotten familiar with all the definitions in your benefits book, all that's left is the actual content. All right. If you're not going to read your book, at least have a copy so you'll know where it is when you need to reference it. Because we understand that reading an entire book can be overwhelming, right? Some people will, some people won't. What I suggest is that you read your entire table of contents and you become familiar with all of the definitions. All right, and then after that, at the minimum, take a look at 3 areas. Look to see what your benefit book covers or includes. Secondly, look to see what it doesn't cover, what it excludes. And then lastly, read up on your rights to grieve and appeal like any adverse determination. A little quote I like to tell people is, you don't have to be an expert in insurance to become informed about your carrier's responsibilities and your health plan rules and your rights as a member, because it's all in your benefits book. All right, just to sort of wrap up and maybe review, understanding your benefits is key to maximizing your health benefits. Or excuse me, I misspoke. Understanding your benefits book is key to maximizing your benefits. And it can help you to avoid problems with your health insurance. So become familiar with the entire book. If reading it cover to cover is too overwhelming, read the table of contents and locate the definition section. Start there. Eventually, you're going to want to become familiar, though, with all of the definitions, the plan rules, what's covered, what's not, and your rights to grieve and appeal. Always refer to your benefits book whenever you need directions about how to use your insurance. And if you don't understand the directions or the descriptions in the benefit book, ask questions. You're a customer of your health plan. It's reasonable to ask them to give you good customer service. So you can call them, ask questions about your benefits, ask them to explain a definition you don't understand. It's reasonable to expect nothing but good customer service from your insurance carrier. All right, so what happens when you don't get good customer service or you get incorrect, conflicting information? That's what everybody really wants to know, right? Well, you don't have to worry alone. If you get confusing, conflicting, or incorrect information, give us a call. That is what OHA does. We are here to help people navigate their insurance and hopefully avoid problems, but certainly help you understand your rights. And that's my last slide, folks. I hope you found this a meaningful topic. Again, we want to thank you for tuning in. And I'm going to turn this back over to Denise. We'll see if we have any questions.
Yeah, so far I did get a question. Is this session recorded? And it is. And if you would like a recording, just email me and let me know and I can send it over. I'll put my email address in the chat as well. And in the meantime, are there any questions?
We do have our email address as well as our phone number and website on the screen in case you want to take a screenshot.
And
I
I put it in
believe,
the chat as well.
and it's in the chat. So yes, I'll go ahead and say thank you then to everyone. We appreciate you joining us. And look at YouTube for the other sessions we talked about. Learning your health plan documents.
All
All right,
right.
be well, everyone.
Thank you.
Bye-bye.
Bye.